Hi, my name is Gabriela Moreno Costa, and this is my persuasive speech on abortion. Do you have your mind made up on abortion? Have you decided how you feel on the subject already? Have you gone through something personal that helps you relate to the subject? Maybe somebody you know has had an abortion for whatever reason. Well, I would like to explain this topic in more detail. I'd like to take you through the procedure as well as the long and short term side effects. I will also be going through all of the reasons someone might choose to have this procedure done. I can only hope that by the end of this speech you are left with a better understanding of the process and that you will have more empathy when speaking about this subject. I can also only hope to continue to convince you that this is an intimate process and that it should be a woman's choice to have this done if necessary. An abortion affects a woman's body in many ways, but it should be her decision whether or not to get one. Not only is this an emotional process of making the decision to get an abortion, but the common and serious side effects of having one can be really, really scary. Some of the short-term side effects of having an abortion include cramping, nausea, vomiting, diarrhea, spotting, or bleeding, which seem normal when you consider the symptoms of pregnancy or just menstruation. But the serious side effects could include heavy bleeding, infection, damage to the cervix, scarring of the uterine lining, perforation of the uterus, damage to other organs, and even death. These risks are very frightening, and if a woman is willing to risk the possibility of these things happening to her, she must have thought it through. There are also some long-term side effects and complications that come with multiple abortions. A 2010 article by Randy Acorn states that women with one abortion double their risk of cervical cancer compared to non-aborted women, while women with 2 or more abortions multiply their risk nearly 5 times. Similar elevated risks of ovarian and liver cancer have also been linked to single and multiple abortions. Now, having a little insight into the risk once a woman has had an abortion, I would like to take it a step back. I would like to explain how a surgical or in-clinic abortion is performed to give a visual of the actual process of an abortion. A lot of people have an opinion on the topic of abortion and don't actually know how one is performed. Generally, they are performed as an outpatient procedure and does not require a overnight stay. But if complications occur during or after the procedure, hospital care may be required. The first step is an oral pain medication, and the time that it should be taken before the procedure varies with whether the woman is under 12 weeks of pregnancy or from 12 to 14 weeks of pregnancy. Once you are relaxed and the medication has been taken, its effect on you will prepare you for the procedure. The first step is a DNC, or a dilatation and curettage. Once the uterus is dilated to the doctor's desire, the uterus will be numbed, the cervix will be numbed, and they will insert a tube that will suction out all of the contents of the pregnancy. The procedure itself is only about 15 to 20 minutes long. After completed, the doctor prescribes antibiotics to prevent infection, but that doesn't necessarily mean the infection will not occur. There's always a risk of infection. Now that the procedure is done, and we understand how it's performed, and the risks of having it performed, let's discuss what we're willing to have this procedure done. There are many different reasons why a woman might choose to have an abortion rather than carry out the pregnancy. This decision is a personal decision on every aspect, on every level, and it should not be taken lightly. However, every woman should have the choice to make that decision for themselves. We should be able to decide if we want to carry out a pregnancy or not. And we should be able to trust that their reason for having this performed is good enough that they do not owe us an explanation. There could be various reasons why a woman might get an abortion, whether it's money problems, their age, or the pregnancy could be a result of a trauma such as a rape or incest. Some women are recommended to terminate their pregnancy because of there's a defect with the fetus. Tests can be done early in pregnancy that test for certain deficiencies and birth defects. And they can also be seen in ultrasound early enough that they might be advised to terminate the pregnancy based on the quality of life that the baby will have. Some women are recommended to terminate the pregnancy based on their own health. If the woman has a condition that might put her and the baby at risk, the doctor might recommend that she get an abortion. All of these are reasons a woman might decide to get an abortion. When you're forming your opinion on abortion, I recommend that you think about all of these aspects that a woman has to go through in the process that they would have to carry out mentally and physically from beginning to end. A woman deserves the right to have that choice, whether they want to go through an entire pregnancy or not, whether we agree with that decision or not. Women should be able to choose. An abortion is a serious life choice and should not be taken lightly, and we do not know what women have gone through, and we should know and be more understanding and empathetic. And I hope that I have persuaded you in the argument that women deserve the right to choose no matter what your personal choice would be.